So I got an email today that reminded me of ATU, and so I really didn't want to do my work, so I was playing around on this and found some new things that they came up with, as well as want to remind you of some of the other things that are great opportunities for you to help learn, especially in this injury class. So the first one that I want to kind of talk about that's obviously the easiest is this special tests, right? If you remember from looking at this, you have the ability to go through and it has all of these different types of special tests, right? And it has the videos associated with it on how to do it, right? It has some of the information we need for our evidence, the positions, all the cues, everything in there. And then this is just the reminding you of those likelihood ratios, what all those mean, different aspects as well. But the real value are these videos where it shows exactly how to do it. Right, so that's really helpful from that. So there are a bunch of the different special tests there, so that's relatively easy to do. All right. They got range of motion, manual muscle testing, but they also have these cool new simulations that are kind of fun for those. All right, so for like a manual muscle test, if we do for the shoulder, for example, right, and you can see I already did this one and I failed, right, which is okay. But go ahead and you can just click on this, right, and work your way through. And it works as a normal aspects. It has, descriptions and things to work with, right? In this case, there's a little video showing where it hurts, questions associated with that, right? And it tells you whether you're correct or incorrect. With that, and then I just want to show you one more thing here that's kind of cool, right? In this case, right, it's interactive. So in what position do you want the arm, right? So obviously it's not way up here and it showed you that it's incorrect, right? And you can do that, but that's kind of cool as a little simulation to like test yourself as well. And they've got that for a couple of those, but they also have how to do them as far as range of motion, all the manual muscle tests here that you would need to do with the videos associated with them as well. Another cool thing that they just came out with here is this, are these palpation videos, right? And so you can walk through and look at the different palpation topics, right? And they voice over this stuff, right? And you can see they kind of do the drawings, and so you can do some of that as well. But then also you have the exercises associated with this, right? And so you can look at the post-operative sorts of stuff. Let's go back to something that we might see a little bit more. Let's go to the knee here, right? We've got post-operative here, some different operation things, the different plans. And the nice thing is these are all interconnected, right? With the phases, the goals, some of the questions with that, protocols associated with that as well. And then if we go back here and we go to something a little bit later, when we get in the protocols, it will also have on some of the exercises that they can do, different things associated with that, right? And so here you can see like here's some interventions and how to do those coming up here, right? So your double leg squats, right, that we've seen do, and the cues, different things associated with that as well. And then lastly, the last cool thing to really go through is this orthopedics. And this now focuses on it backwards from the patient standpoint. And so you can kind of test your way through opposed to just looking at specific special tests and all that. And you can as well here. But at the same point, you can do this clinical pattern recognition stuff. All right, so now we have shoulder. What if they're complaining with, sharp, deep aching pain? What sort of injuries might be here? What sort of red flags are we looking for really weird things? right? And then it goes into these, and you can get into these different injuries, right? How often they occur, is in their prevalence, their clinical findings associated with this. Sometimes have videos. Here's discussing the histories, right, with that. And it's all linked, right? So your secondary survey, right, they're going to have positive biceps load test. So what is that? And it comes back to this here, and now you have the biceps load test, right, and the different information all associated with that. So you guys all should have access to this. Previously, you may have to look up your information, but we bought this for you. Please use it as a resource.